My name is Paul Meister and I live in Maple Grove. Others have pointed out that requiring gender identity curriculum and instruction violates the district's. Others have pointed out that requiring gender identity curriculum and instruction violates the district's own policy on sexual education, as there is no opt-out option, despite there being an opt-out option for the sexual education that has been delivered up until now. Rather than discuss that further, I'm going to highlight a feature of the transgender ideology that is inconsistent. I've been a doctor for 18 years. My specialty is emergency medicine. Let me tell you about appendicitis. Appendicitis is when the appendix gets inflamed or infected. The long-accepted treatment is surgery to remove it. It's one of the oldest surgical procedures with a very low complication rate. Decades of data and experience support the idea that this is the preferred treatment for appendicitis. Imagine you're 12 years old and you come to my ER, and after some tests, I diagnose appendicitis. I will call a surgeon who will have a detailed conversation with you regarding the surgery. You will be asked to sign a consent form after having a discussion with the surgeon about the pros and cons of surgery, and you feel all your questions are answered sufficiently. This is called informed consent. Again, straightforward surgery, lots of data, high benefit to risk ratio, pretty simple. Arguably, there are almost no significant long-term complications. But wait, you're only 12 years old. You didn't even drive to the ER because you're not old enough. Your parents had to bring you. And as an ER doc, with very few exceptions, I can't even treat you without parental consent except for life and limb-threatening conditions. So what that means, practically speaking, is that your brain is not fully developed to make decisions about your own health and well-being. I don't say this to be mean to you, or any child for that matter, or any former child in the room. It's simply a known fact that the human brain is not fully developed until well after high school. So besides the fact that you can't sign the informed consent form, there is no credible surgeon in the country that will allow you to sign it. In fact, there is no hospital legal department that would allow the surgeon to even claim they had an informed consent conversation with a 12-year-old. The informed consent form for literally every procedure in every hospital have a place for a parent or guardian signature. In almost 20 years of doing this, I've never seen a form without it. Remember, you didn't drive to the ER. You got a ride because we don't allow 12-year-olds to drive, or smoke, vape, drink alcohol, get tattoos or piercings, do adventure races, skydive, scuba dive, bungee jump, or even jump at Sky Zone without parental consent. Some of you are wondering why I spent 2 minutes talking about appendicitis and informed consent. The reason is because the logical conclusion of encouraging kids to pursue transgender ideology is eventually hormone blockers and surgery. And we are supposed to believe that a
30 seconds
12-year-old
remaining.
should be allowed to consent to such a life-altering surgery to remove body parts, the removal of which changes the course of that child's entire sexual future and reproductive options. Surgeries that do not have decades of data and experience to support a favorable benefit to risk ratio. Surgeries that have very little research behind them and virtually no long-term outcome data. That's inconsistent, to say the least. Thank you.